November 17th, we're at the National Arts Centre in Ottawa, and I'm talking to Dr. Irfan Dhalla
Yes.
with the Canadian Physicians for Medicare.
Yes, Canadian Doctors for
Canadian
Medicare.
Doctors for Medicare. And we're at the 30th anniversary gala celebration of the Canadian Health Coalition. And we're talking about threats to Medicare and the future of Medicare. And I thought we were just listening to a panel in which you were talking, Dr. Dhalla, and I was interested, for a start, in your account of talking to some physicians from Texas, from some doctors from Texas who happened to be in Toronto for a conference. Could you contrast your experience as a doctor with theirs?
Sure. I think, one of the things we're here doing also is celebrating Medicare, and that became, I think, very apparent in this conversation I had with a group of physicians from Texas a few months ago. It's very clear working in a system like ours that our patients have great access to physician and hospital services. We don't have to worry about whether they'll be able to pay a bill or not. It's also a lot simpler for physicians who work here. In talking to these doctors from Texas, it was really interesting to hear their perspective and how much time they spend dealing with insurance companies and doing paperwork compared to how little time I have to spend doing those kinds of things here, which of course lets me and my colleagues spend our time focusing on patients, which is ultimately what we want to do and why we went to medical school in the first place. I thought that was actually quite instructive, and as we were talking, I could see these doctors from Texas becoming quite envious, in fact, with the way certain aspects of our healthcare system are structured.
I see. So you find as a doctor there are material benefits to having the kind of Medicare system we have here as opposed to the privatized approach in the States?
Yeah, I think those are clear. I mean, the biggest benefit for sure is for our patients because they don't have to worry about having to pay for health care. Any patient can walk in off the street in Canada, and so long as they're a resident of the province, they'll have access to, the best health care available, which is not something that can be said about the system in the United States. But there are also these other benefits for doctors, namely that our paperwork requirements are less. We don't have to chase unpaid bills. We don't have to deal with insurance companies. I work in Ontario, the Ontario Health Insurance Program. They never call me up and tell me that I can't do something or that I have to discharge a patient. And in speaking with these physicians from Texas, those kinds of things are fairly routine occurrences down there.
Now, there are some real threats to our healthcare system in the form of some of the private clinics that are springing up. You mentioned, for instance, the Copeman clinics in British Columbia, and I was pretty shocked to hear some of the practices they use in order to skirt the rules of our system. Could you mention a few of these details for our readers and listeners?
Sure. So, since the advent of Medicare, there have always been some clinics charging user fees or having annual fees or deductibles for patients. And, in fact, it was those kinds of activities that led to the passage of the Canada Health Act in 1984. And since the passage of that bill, we're supposed to be having a system where user fees are not allowed, deductibles are not allowed. But over the last few years, we have seen a proliferation of some private clinics and especially private surgical centers that operate at the margins of Medicare. And, I'm not a lawyer. I can't be sure that they're violating the law as it's written. I mean, there may be some loopholes, but it's pretty clear that they're violating the spirit of the Canada Health Act and, this fundamental principle that health care should be based on need. So people who need health care get health care, and health care should be based on need and not an ability to pay. And that's a value that resonates with most Canadians, the vast majority. If you do surveys, it's generally well over 80 or 90% of Canadians believe in that value, that healthcare is a fundamental right and that it should be based on need.
But the support for our healthcare system in Canada is being undermined in many cases by service concerns, isn't it?
I think if what you're alluding to is that there are some, there's sure. So I think the public supports these values, but of course, at the end of the day, they want to see a high-quality healthcare system that is there for them when they need it, and and they deserve that. I think Canadians have the right to that. So, what that means practically is that if wait times become excessively long, it's only natural, I suppose, that we'll see public support diminish. So, in my view, the solution to that is to make sure that we have a high-performing healthcare system, one that provides high-quality care to people when they need it, where they need it, in the way that they need it. And some wait times are definitely too long.
Thank you very much for your time today.
You're welcome, Ish.